Hello, and welcome to our third Spectrum Health School Health virtual series. I am Dr. Lisa Lowry, Section Chief of Adolescent and Young Adult Medicine at Helen DeVos Children's Hospital. In this series, we are connecting you with community experts to answer the questions that are most important to you and your family regarding COVID-19 and the back to school season, whether it's in person or virtual. Tonight, we will be focused on navigating COVID during this school season. We all know this school season has looked and felt a lot different than what we have experienced in the past. Throughout our dialogue, we want to hear from you, our viewers. So please post your questions in the comments section on whatever social media platform that you are joining us from this evening. We will be recording this event to share for those who could not join us live. This week, COVID-19 cases are increasing not only nationwide, but here in our West Michigan community. We continue to set records with our number of daily cases, and our hospitals are seeing an increase in the number of COVID-19 patients. Even as of yesterday, our president, Dr. Dale Amucci, noted that our largest one-day number of COVID inpatients in the spring was 86. Our number on Monday, October 26th, yesterday, was 156. We know that some of our school districts are dealing with pockets of outbreaks, forcing schools to go back to virtual learning. This means we must continue to be careful to avoid contracting the virus and to prevent the spread of the virus in our community. Tonight, our experts are going to address this uncertainty and give you some ways to help that will help you and your family cope. To get us started this evening, I will invite my expert panelists to take a couple minutes and introduce themselves and share any observations that they have seen so far this year. My first panelist, Dr. Rosie Olivero.
Hi, good evening. My name is Rosie Olivero, and I'm a pediatric infectious disease specialist at Helen DeVos Children's Hospital. I'm also a division chief here at the Children's Hospital. And really, like most of us, COVID-19 has been a roller coaster. And as an infectious disease specialist and also as a mom of 3 young children, this has really felt very much like whiplash from one extreme to the next. My observations so far is that, the initial parts of the school year really were going very well. Our children were excited to be in school. The school districts that we are most familiar with were doing a really wonderful job in keeping up with their mitigation strategies. And we were really starting to feel a little sense of normalcy. And we really hope that will continue because the physical and psychosocial aspects of children being in the school environment, if that's what parents have chosen to do for their children, really are just so beneficial. Now, in the past couple weeks, of course, we have seen that our numbers of COVID have been increasing at a pretty alarming rate. And it's time for us to really think very critically about what we can do to slow the spread of COVID so that we can keep schools open, especially for the children who need it the most. So I'm really excited tonight to go through and hear from all the different panelists to discuss all these different strategies so that we can tackle this issue head on and so that we can keep schools open as long as we possibly can.
Thank you, Dr. Olivero. Next, we have Mr. Kevin Polston from Godfrey-Lee Public Schools. Kevin?
Yeah, thank you, Lisa. Excited to be here tonight. I'm Kevin Polston, Superintendent of Godfrey-Lee Public Schools, and I'm a certified educator and an uncertified parent of a 9 and 12-year-old. It was an honor for me to serve on the Governor's Advisory Council and represent West Michigan, as well as being one of 2 local superintendents on that council to create the roadmap for return to school that allowed for a safe yet sensible return. And I'm proud to see it in action and the mitigation strategies that overall are working well in our schools. Even though COVID-19 we know has dramatically impacted our way of life, and I want to say that my heart goes out to those that have lost loved ones to the virus. We know it's impacted communities differently and disproportionately impacted our communities of color. And while COVID is a significant factor of public health, we must look broadly at overall health when making decisions about school and consider the social, emotional, and physical well-being of our students when making those decisions. And I'm proud of Godfrey-Lee that 50% of our families chose virtual and 50% of our families chose to be in person. I'm proud that we've been able to offer that. We couldn't do it without partners, and Spectrum is a great partner for Godfrey-Lee, and through the Healthier Communities Initiative, partially funding a full-time nurse for us, and our nurse, Rachel Collins, is a rock star. She's been wonderful. Spectrum's also donated 2 large shipments of PPE, and we also utilize the Return to Learn guides at the onset. And we've also had other partnerships, including Kent County Health Department, who has given us their tireless support and resources. Kent County Commission has allocated $3 million in CARES funds to schools throughout Kent County to assist with COVID relief, and also to our philanthropic community. Together, we're making it through this, and we know that schools can't do it alone. Look forward to sharing more tonight.
Thank you, Kevin. That's a great example of our strong West Michigan community pulling together. And you mentioned the partnership with the Kent County Health Department. I'm going to introduce our next panelist, Ms. Joann Hoganson from the Kent County Health Department. Joann.
Good evening, everyone. My name is Joann Hoganson, and I'm a registered nurse. And I work here at Kent County Health Department. When it's not COVID time, I'm the Director of Community Wellness. But since COVID came to West Michigan, I've been working as the liaison between the Kent County Health Department and the schools. And that's been a real challenge, but really a pleasure to me too. I've met some fantastic partners, made new partnerships that we hope to leverage forever as we work with Kent County Health Department and the schools. But one of the things I want to just let everyone know is we are really proud and pleased with how the opening of schools has gone. It hasn't been perfect, but we would not have anticipated it to go as well as it has gone. And I think that that is a credit to the fact that the strategies that we put in place, along with the superintendents and the principals and all the educators, we put in some important strategies and we hoped that they would work. And for the most part, they have worked. We've been able to keep most kids safely in the schools. And it isn't one strategy that's going to make a difference. It's layers and layers and layers of strategies. No, not any one of those strategies is perfect and effective by itself. But if you layer on the strategies like wearing masks and hand washing and social distancing, and when an individual has had an exposure, that person, whether it's a student or a teacher or someone that works in the building, has to stay out of the building. When you put all of those things together, the quarantine, the excellent practices that are keeping our kids safe, we are working hard to prevent the need to close down schools. We don't want to come afterwards and have to advise schools that they need to go to all virtual. We think that putting more choice in the hands of the parents is a great way to go. And we enjoy working together with the schools because we recognize that school is more than just learning reading and writing and arithmetic. It's about their social development and their emotional development, and it supplies so many important things for our students.
Wow, thank you, Joann. And I think that you hit on the point. And one of the reasons we have such a great panel of experts representing schools this evening. So next panelist is Heather Norman, who's from Comstock Public. Let me slow down. Comstock Park Public Schools. Thank you.
Hi, good evening. My name is Heather Norman. I am the district nurse for Comstock Park Public Schools. I work through Spectrum Health and Healthier Communities as their district nurse. And I think my initial observation for this year is I have so much pride for our West Michigan community and for our Comstock Park community, especially the amount of work and dedication that's gone into this year from our administrators to our educators to really our parents and our students. I have been so proud of our students for something that I think everybody had anxiety about going into the beginning of this school year. The students have really just excelled at the new normal and done better, I think, than anybody could have predicted. And so I hope that we continue on that and we continue to take the strategies seriously that we have in place, because we've done a really great job so far about mitigating the spread within the school districts.
Wow. Thank you, Heather. And next, Karlie Parker, who is from Muskegon Area Intermediate School District.
Good evening. I'm Karlie Parker, Associate Superintendent of Special Education for Muskegon Area Intermediate School District. In my position, I have the opportunity to work with all of our local districts and to run our center-based programs that support our most complex learners from across Muskegon County. I will say in my 23 years in education, this August was simultaneously the most exciting and scary time of my career. I've never been so excited to welcome students and families back in through our doorways, while also being concerned about what that meant for our buildings and our teachers and our ancillary staff and custodians and principals. So I could not be prouder at how the community here in Muskegon County has rallied around to make sure that all students who wanted the opportunity and families who chose to send their students back to face-to-face instruction had the opportunity to do so and do so successfully. Our instructional assistants, our teachers worked tirelessly before the start of school to work all of the best practice mitigation strategies into their daily routines. We put in place symptom checkers for all of our staff and for our families to use prior to beginning the school day. Families have been amazing communicating with us if they have any questions or concerns about the health of their child, and have really dedicated that time to helping us help their children rise to the occasion for participating in all the mitigation strategies, mask wearing for even our most complex kiddos that families have practiced at home, that they utilized social stories for, and kits that we sent home to practice prior to school. So the community support we've had from the health department, our local superintendents, our ISD staff has just been amazing. And we have been really pleased to bring students back on site.
That's great. Thank you, Karlie. And I think you hit on a point that maybe we can touch on later. Going back to school is just not important for the kids and the families, but for the workers. People went into education to interact with our students. And so, and coming from a family of educators, I know it's very important to have that student contact. So first question, I'm going to throw it to Joann. And this question is, how are our schools doing in regards to the numbers of confirmed COVID-19 cases?
Thanks for that question. In general, the number of children that are impacted by COVID is much, much lower than for older people. COVID is an unusual disease because many infectious diseases that have hit throughout history have hit children much harder than adults. Examples are polio and measles and chickenpox and diphtheria and other diseases that are often much harder on little children than they are on adults. We would call those childhood infectious diseases. But COVID is quite the opposite. It's has much greater impact on older adults. And I have here the statistics that are most recent about the cases. In children ages 5 to 10, only 2.2% of the cases in Kent County have been in children ages 5 to 10, 2.2%. And over the last 6 months, it's only been 1.9%. So our kids are less impacted by COVID. And also when they do get sick, they usually have a much less serious case. The hospitalizations are less, and they usually recover very quickly without a lot of ongoing problems. In fact, many kids may be COVID positive and not even know it because they don't have symptoms. The numbers go a little bit higher when we're talking about 11 to 18-year-olds. The total percentage out of 100% over the last 6 months, 8.1% have been among people who are 11 to 18 years of age. This fares really well for our schools. In fact, when we see cases of COVID in the schools, they're very often among teachers and staff, which makes staffing our schools very difficult, and less so in children.
So, Joann, I want to follow up on a question, and I know we're getting a lot of Facebook comments about schools going virtual or maybe having to go virtual soon. What is the health department's role when guiding school districts when they make decisions to conduct, in-person versus virtual learning?
Well, that's a very good question, and we're still working through it every single day. We're still trying to figure out exactly what our role is in working with the schools. But I want to emphasize what I just said, that last statement. We want to work with the schools. Our goal as a local health department, we're not necessarily educators, even though lots of us are involved in education. We're primarily public health people. I'm a nurse by profession and by training. And so I come alongside the educators and we try to evaluate what is in the best interest of the school and of the students and of the people that work in the school. So for the most part, we come into the school as advisors. We understand public health. We understand the way infection spreads. We understand what needs to be done to stop the spread of infection. And so we try to advise the schools when it's time to start taking actions to prevent the spread of the virus. I'll tell you, we much prefer preventing than reacting. So if we can help to prevent kids from being sick or prevent teachers from being in isolation or quarantine, we would much rather do that. But sometimes there does come a time when the spread begins to accelerate. And sometimes you have to break that chain of the spread of infection. And when that time comes, we step in and we give that guidance to the schools.
Thank you. And I know parents are so frustrated. It's like, is it one positive? Is it two positives? Is it a classroom? And
Right.
And I'm actually going to have Kevin even comment on why are school plans so different?
Well, each school's plan is going to be reflective of the conditions that exist in that school community. And so while technology readiness or the physical school buildings readiness as far as air handling or making sure that there's enough space for distancing in classrooms is going to be unique in each community. One of the things we've also known, as I mentioned earlier, is that communities of color have been disproportionately impacted by COVID-19. And so our survey that we did across the county in the early part of the summer demonstrated that our African American and Latinx community was much more reticent about coming back to in-person than we saw in other racial demographics. And that bore out in the percentage of families that chose to become virtual learners in the districts where there was a choice. And so what's really unique is the reflective conditions that exist in each community, and each plan is going to meet the needs that exist in that community.
Thank you. So my next question is going to be, I'm going to throw it to Karlie. And because I know you mentioned really working with complex students, how important is it that we have started bringing our complex students back into the classrooms?
Good question. From the onset of developing our plans to return to school, I wanted to make sure that all of our students had similar opportunities for their families to make choices, to make a choice whether they were most comfortable to continue in a remote or distance learning setting, or whether or not they were comfortable returning to school. So we started surveys during the summertime to see where families stood with that. And we had about a 50-50 ratio throughout those times. And as we got closer to school, we had a few more families, once they realized the mitigation strategies that we were going to be putting in place, that we'd worked so closely with Spectrum Health and our nurses that are present at our center-based programs, and how seriously we were taking the safe return, that they felt comfortable having their students return to school. The mixed conditions of bringing our complex students back is that we did need to ensure that we were putting all of the highly recommended practices into place in order to do so, while recognizing that the accessibility for instruction at home for some of our learners in those centers was very difficult due to the equipment and supports that they require, due to the complex social emotional needs that they have. We felt it was really important to try and bring as many students back as possible. We're just getting ready to enter marking period number 2, where parents were able to redesignate for our center-based programs their preferred mode of instruction. And what we saw was a little fluidity. We have some families that are now comfortable in wanting to return on site. And we have a few families that heading into the winter and with the uptick in the community have chosen that they'd like to move to a distance learning platform.
Thank you. So I know I mentioned earlier at the onset that we've had more cases at the hospital. Dr. Olivero, are patients being admitted specifically for COVID, or are the patients who happen to be admitted testing for COVID? Can you comment on that?
Yeah, that's a very interesting question, and I would say both of those things are true. What is something that we've been tracking very closely in West Michigan are those people that are admitted for COVID, but then also the whole hospital census. So where are patients filling up the hospital? And so both are happening. So we have patients being admitted, especially in the last 2 weeks, at much higher numbers who are actually sick with COVID. And the numbers have increased quite a bit. Lisa, I believe you mentioned the numbers earlier, but as of Monday, we had 156 patients in the hospital with COVID, and that's approximately double what we had in our first peak back in the spring of this year. So really the number of patients with COVID are much higher. Now, there are some patients who are screened for COVID when they're coming into the hospital or going to have a surgery, and sometimes they're incidentally found to have COVID-19. And that's important to know for putting patients in appropriate types of rooms and protecting our staff, because we take some extra protective measures. But really those people who are found to have COVID-19 that aren't symptomatic, that number is actually quite low. It's been a very low number, which is good for the healthcare environment in general. But because we have such a higher number of patients in the hospital environment with COVID-19, and we have quite a bit of other patients who are in the hospital for other things that happen all the time anyway, strokes, heart disease, children get sick from other respiratory illnesses. They can have an injury or a trauma or need a surgery. So those patients at in our Spectrum Health facilities are high right now as well. So in general, we are moving into a phase where our hospital is much fuller than it had been, especially in the spring and the summer. And so, of course, if we remember early in the pandemic, where everybody was talking about flattening the curve. Flattening the curve was the whole rationale for our really dramatic measures to try to stall COVID-19. That was because we were trying to slow the spread of COVID-19 so that the hospital environment wouldn't get overwhelmed. And that's important because if you get to a point where the hospital system is very overwhelmed, like what happened in New York City and Detroit, then our ability to provide timely, effective care to all the patients that need it can be impaired. And that's really, when it comes down to it, when we think about the community, that is indeed the most important thing for us, is to be able to care for all the patients who are sick. So one of our major calls to action right now is to take those strategies really seriously, because we really would like to see that the COVID-19 spread to slow down in our community so that we don't overwhelm the healthcare environment. I think one other important point is that it's not just the initial high-risk groups that are being admitted with COVID-19. We actually have several young adults who are being admitted who are very sick from the virus as well. So it's not just the medically frail, but there's others who are being admitted with very severe COVID as well. So we want to be able to provide for the community as best as we can. And so that's why this is so very, very important to us.
So, Dr. Olivero, I would be remiss, and I'm going to pause right there. What should we do about Halloween? How should parents, teens, kids, how should we handle Halloween this year?
Oh, Halloween. Well, Halloween is a really fun time of year, and it's this year it will undoubtedly look different than it has in prior years. And that is completely appropriate, and we should expect and prepare for that given what's going on in our community right now with COVID-19. So many traditions of Halloween, and many of those we have to think about very critically to see which ones could be more risky in terms of the risk of transmitting COVID-19, not only to yourself and your children, but to our community in general. So the guiding principles for how to handle Halloween are very similar to the guiding principles for mitigating the risk of COVID in general. So it's our physical distancing measures, our wearing of masks in public, avoiding crowds and high touch surfaces, frequent hand washing and using of hand sanitizers. So how do we incorporate all of that into our Halloween activities? Well, there's a few that the CDC came out actually over a month ago and spoke up about being higher risk activities that we should really discourage right now, given what's going on with COVID-19, especially with what's going on in West Michigan at the moment. So those beloved indoor Halloween parades or parties or trunk or treat activities where you have parents, relatives, kids, teachers all packed into small spaces, those really are higher risk activities, and those should be avoided. Similar to that would be trick-or-treating activities that are in crowded areas where people are hoarding together very tightly. Even though it's an outdoor activity, if you're in close proximity to others, some of the benefits of being outside can be lessened. So really those crowded trick-or-treating or trunk or treat activities should really be avoided. So those are the highest impact activities that we would like to avoid given what's going on with COVID-19 in our community. So what things can be done more safely? Well, you could get really creative, and I encourage parents to get creative with how to have a fun Halloween this year. A handful of different ideas have been put out on social media. The CDC had a couple ideas. Kent County Health Department put out some fun ideas as well. You could do a treat drive-by where you throw candy out at passerbys. You could do outdoor treat hunts, kind of like an Easter egg hunt with your family. You could do dress-up Zoom parties with your friends and relatives. You could really play up your favorite treats or make some of your favorite treats more Halloween-ish, and get really creative and wild with costumes and putting the emphasis on having it be fun so that kids and parents don't leave the holiday feeling disappointed and that they missed out. And any activity, I'd like to just emphasize, any activity that I mentioned that we think is a lower risk, but you're out in public, really still emphasizing the mask wearing and frequent hand washing. And please do think about the quality of the mask. So we want to stick with the same quality of masks that we're using in public and that we're using in schools. The masks that are provided by costumes, those are not necessarily sufficient. They don't have enough barrier protection, and some of them it's just plastic with some holes in it. So you could see that wouldn't necessarily be sufficient. And then also layering some of those masks on top of your high quality masks sometimes can cause difficulty breathing. So in general, I would try to avoid the costume masks for this Halloween. And then at the very final thing I want to say, the safest thing to do for Halloween festivities, given what's going on, is something that you can do in your home environment, not in public. So at the end of the day, we feel so deeply about kids being able to stay in school if that's the choice of their family. And we don't want to let the Halloween activities really go in place of the safety of our schools and our community right now.
Wow, thank you. Such great tips. All right, so you just can't put that, that Black Panther mask on and just go out. So you need to remember to layer it. So I'm going to ask Heather. Heather, can you reflect on how important is it for there to be communication between parents and students and the schools?
It's so important. I think especially this year, it's always important every year, but telling us the most up-to-date information as soon as you get it is extremely important. The worst case scenario, when somebody in the family receives a positive test result, getting that information to the school so that the school can start that contact tracing process. But every day we are asking our students to complete and the parents to complete daily screeners and making sure that they don't have symptoms. Just that reminder question of, Are you awaiting a test result for COVID? Those kind of things, that communication daily is so important to us, because we can only do our job as good as the information that we receive. And I'm so proud our parents and our students and everybody, the educators. The communication this year has been amazing and difficult, but I'm very, very proud. And I just want to touch also on, there's no magic number. That's probably a question I get from parents very frequently. What's the magic number? When is my classroom going to be shut down? When is this going to be shut down? There's no magic number. We really do work. Every case that we get is different. Every contact tracing that we have to do is different. And so we work every single case with the health department to really only make sure that we're quarantining those students that absolutely need to quarantine, to be positive on that, and to know that we're giving that chance for education to all of those students and families that need it and need to be in the school setting.
Very good. We don't want to put our students at risk. We don't want to put our faculty at risk.
Yeah.
So I'm going to have, this question is from Facebook, and I'm going to read it, and this question is going to be for Joann. It says here, I have heard many people say that no COVID cases have been transmitted in the schools. Asymptomatic kids are not getting tested, so how can people be so certain of this? I understand that positive cases have been traced back to transmission outside the schools, but there's really no way to know that absolutely no cases have been transmitted while at school. I feel that this is giving people a false sense of security. Can you comment on that?
Yeah, I'd be happy to comment on that. We absolutely have no way of guaranteeing that there has been no transmission of COVID-19 in the schools. For many, many of the cases that we have where people, whether they're children or adults, test positive, we do a contact tracing, and we come up without really knowing where they ever got the virus. So it is not a true statement, and you probably wouldn't hear that from Kent County Health Department. At least I hope you wouldn't. That no cases were transmitted in schools. When we know how a person was infected, because sometimes they're household contacts with someone that is positive, sometimes they had a known exposure, they might already be in quarantine because they had an exposure, then we usually presume that that's where they got infected, but we really don't know. And we have a whole bunch of people, a large percentage, where we don't know. We don't even know where it might have happened. And it could have happened in school if they were in school. However, when we do know, when we have a real way of saying this is where the exposure happened, and then 2, 3, 4 days later, they test positive, that it doesn't tend to be in the classroom. It's usually in outside activities. A lot of times it's social activities like parties or homecoming events, or a lot of times it's sports activities. And most commonly it's in someone's home where they are living together, their household contacts with someone that's positive. But there is no way we can guarantee that transmission does not happen in the classroom. We don't think it's happening much, but we cannot say that it's never happened.
Oh, thank you for that clarity. And I'm going to pause before I have Kevin, a question for you. But the other thing, we talked about Halloween, but Joann mentioned homecoming. Just because you don't have those homecoming home parties, or don't go rent halls. And so I just wanted to put that plug in. So Kevin, this question is that Godfrey-Lee was the first school in Kent County to participate in a rapid COVID testing pilot with the health department. Can you comment on how that's going?
Yeah, it's going really well, and we feel honored that the Kent County Health Department chose Godfrey-Lee to pilot the program and to get that service to our community. And we really believed in strict adherence to the mitigation strategies, and so we utilize an electric screener provided by the Kent County Health Department, and that identifies if someone may have symptoms consistent with COVID-19. And if someone is symptomatic, whether it's a student or staff member, then we follow up and do a secondary screen, and then go forward to make a determination if they're eligible for testing. Anyone who is also a close contact is also eligible for testing. And the way that it works is it's a saliva test that is processed right here in Grand Rapids at Arctic Medical Labs. They're one of 5 labs in the country that can use a PCR test. Sorry, my motion sensor. Sorry about that. They're one of 5 labs in the country that can use a saliva sample for a PCR test. So it's a highly reliable test. And the best part about it is we're getting results in less than 24 hours. And so our families that have a student that's symptomatic, they pull up curbside. One of our staff members that's trained dons the appropriate PPE, brings the test out to the car. The parent assists the child with providing the sample. It's brought in a sealed bag, and the lab picks it up daily. And so the most important part is the rapid response, again, less than 24 hours. And so we can make important decisions about someone's health, get them the supports they need, or if needed, do contact tracing to really contain the spread. And so we've been very pleased. We're entering our second month here in a couple of weeks a couple days. And it's been a very successful pilot, and I look forward to that hopefully expanding soon, because we believe testing is an important mitigation strategy to prevent the spread of COVID-19.
Wow, amazing. That is really kind of a different normal, but great access to that and great resource for that family. Karlie, can you comment on how are students and staff managing their new normal in the classrooms, and how are school administrators supporting them during this time?
It's a lot. We went into the school year recognizing that our personnel, whether it was maintenance and facilities, teachers, ancillary staff, were all coming back with additional stress to have their own families going back to whatever settings they were, childcare, or school themselves, and then coming back into the classroom. So here at Muskegon ISD, we actually invested quite a bit of time during the closure into supporting mindfulness and different strategies for our administrators and our personnel to be using with themselves and with the students to help alleviate some of the stress that we knew was going to come with our return to school under these different conditions. We also have done a lot of debriefing. When we first returned to school for our center-based programs, we built in a half-day schedule for a period of time where we were able to debrief each day about what had gone well and what needed adjustments as far as our mitigation protocols, as far as student support. Our students had been out of the school setting for a significant period of time. Some of them had had significant things happen in their lives outside of school, COVID related or not, due to underemployment, due to transiency, that they needed additional social emotional support with. So making sure that our counselors, our social workers, and our classroom staff had some additional resources in their toolbox to help our students come back. And in addition to that, made sure that our families were comfortable reaching out to us for whatever supports that they might need in regards to their student returning and or things that were going on in their own home that they needed social emotional support with.
Great. I mean, so you highlighted some stress. So I'm going to ask Heather, how are the schools handling the stresses of kids being called out of class and told to quarantine?
I think it's been an adjustment. I know for our secretaries, for our administrators, there's a lot more work. Just, when we contact trace, sometimes things happen in the middle of the day, or, parents might call in the middle of the day and say, hey, we just learned we're close contact, those kind of things. But I have been so proud of our teachers and our secretaries, our administrators for handling the challenge this year. We have a really good system set up where if we know a student's going to be out for a couple of days or an extended period of time, how to kind of transition them to that remote learning, or whether it be packets that we send home, those kind of things. Our teachers have really stepped up to provide some of those extra services. I think no matter what, this year is just a little bit more stressful than other years in some of those ways, but we have done a great job as an administration team within Comstock Park about planning for this year. We had luckily a little bit more time in the summer to understand what might happen, and planning for, okay, we might find out that day that they're going to be out for 2 weeks, or we might, maybe we do need to shut a whole classroom down? What's that going to look like for that teacher? Kind of playing through some of those strategies and having that time during the summer to make some plans for when that happens was very, very helpful. And our teachers have done an amazing job.
Wow, that's amazing. I can't imagine how all those moving pieces. So we talked a little bit about Dr. Olivero, just about social distancing and not having parties and masks, but what does safe social distancing look like?
Safe social distancing. Well, I think that when we're coming down to actual socializing, that can seem like a little bit of a misnomer, at least in the, when we used to, the ways that we used to socialize. But one thing I do want to say, and Dr. Fauci has emphasized this several times as we've heard him speak, is that social distancing, it's not really as much social distancing as it is physical distancing. Because you can be physically distant from the people you care about while still being social. And I think that we need to take that spin as we're thinking about interacting with our friends and loved ones. So this summer and early fall, being social but physically distant was pretty easy, all things considered. But that's not so much when we start congregating indoors more. And this is an issue because of space, meaning when you go indoors, those spaces are generally smaller and they're tighter spaces, but the ventilation is a big difference. So outdoors has the best ventilation, where indoors is extremely variable depending on where you are. So we have to think about that. It just changes because you're going indoors. Now, many of the recent transmission events that have been studied are in our smaller groups, even those that are less than 10 people who are hanging out together without their masks on. So I think it's really important to think about when you're getting together with other people and you're going indoors, if they're not your household members, you should really be considering wearing your masks during those interactions. And I know masks aren't the favorite, but they're needed. We all think about coming home and just taking off the masks and putting them away. And that's perfectly fine if you're just with your family. But if you're seeing a friend or a loved one, someone who isn't inside your house, mask wearing indoors should be strongly encouraged and could potentially allow you to have a physically distant social interaction, especially if it's not with a large amount of people and it's in a larger space. Think about your hangouts going virtual only. So instead of sitting next to your friend and playing video games, do it while you're on FaceTime. Or if you're lucky enough, using a live gaming console where you can interact with your friends in real time, but be in different physical spaces. For our sports families, we know that masks are mandatory when you're on the field. And I think that's really, it was a little bit difficult at first for people to get into, but really, especially now that it's so cool outside, people are embracing it in some ways. And I think that's been a really nice strategy in the state of Michigan. So after you do all that work of wearing your mask while watching your kid or when your kid's on the field, don't undo all that good by going to a post-game social event while not wearing a mask. So that can be really important as well. And I think it's important to emphasize for parents to talk with their teens and adolescents about this topic because it's going to come up. Encourage your kids to talk with their friends about it and encourage yourself and your kids to plan ahead to avoid awkwardness and unsafe situations. Talk to the other parents, see what's going on, make sure you feel comfortable for yourself and for your teen or adolescents. And this is hard. Winter is hard to begin with, but we do need to take this very seriously so that we can hopefully back off of the bad situation that we're currently heading into.
Yeah, and I think it's so important. And thank you for this great expert panel. And, we're really all feeling that. I don't want to even say COVID fatigue because this is a marathon. And I think even a lot of us were like, okay, it's going to be better in the summer. Oh, no, okay, by the way, flu's coming. We're going to be all right. Okay, all right. But really having this new normal, making those conversations with our friends and families and loved ones and having those tough conversations with our kids saying, you know what? You can't go and play over that house because of this reason. So I want to thank this amazing panel. I want to thank our virtual audience and lots of great feedback and engagement. And thank you for joining us for Spectrum Health's third School Health Virtual Series. This was amazing, encouraging. Please feel free to visit Kent County Health Department websites as well as Spectrum Health websites for more information. We plan to share the recording of this on our website Spectrumhealth.org is where you can find many other resources to stay healthy and well during this school season. We look forward to you joining us for future sessions. Our next session on November 12th will be on staying healthy and staying well. Again, thank you to my awesome expert panelists. Thank you. Please stay healthy. Please stay safe, and have a good night.
Thank you.